Welcome back to our program, Poverty's Impact in Central Texas. This is our third segment, and we're going to really be focusing on health care and services in our area for the indigent, poor, and homeless of our region. But our main focus, we've talked about the mental health issue, which we'll probably get back into again. We've talked about the overall problem and the scope of the issue in Central Texas. And we discovered in the last segment, we're actually number 12, unfortunately, nationally for evictions, which is in part causing some of our numbers in Central Texas to be large. My guest for this segment, to my immediate left, is Marlene Dillilo, and she is the director of the Greater Killeen Community Health Clinic. Now, that was formerly the free clinic, and it's been in business a long time, and it's still serving people. And to my far left, I have Neeta Gilchrist-Brake. She holds a master's in social work, and her position is a navigator and caseworker for the Bell County Indigent Health Services. Welcome, both of you.
Thank you.
And thank you from the start for, choosing to serve the region in the professions that you've chosen. And, as you do it, I know just being here in this job and having all of you come in, my heart is shifted. My heart is changed by what I hear. And actually, I think I've been humbled by what is going on in the community, the hands-on help that Central Texas is co-laboring together to provide. And as Marlene said before we came on, there is not competition between agencies here, there's collaboration. In the faith-based portion, the initiatives in our region work so well with the state of Texas and in federal programming. So we are truly blessed, but we do have some issues. And I'm going to start with Marlene and just ask you each day, how long have you been? And tell a little bit about the services, of course, first.
Okay. Of our clinic?
Yes, ma'am.
Yes. Well, I've been at the Greater Killeen Community Clinic for almost 24 years.
My goodness,
and yes,
I did not know that.
I have to leave someday, but we'll celebrate our 25th anniversary next year. So
you were right there from the founding.
Almost, yes. So we provide a full range of primary health care services, except for women's health, to low-income, uninsured children and adults living in Bell, Coryell, and Lampasas counties. Okay. We serve people that get sick with acute illnesses like the flu. We have a very large chronic disease management program. We also
provide... Such as diabetes and...
Diabetes, hypertension.
Yes.
Cholesterol, heart disease, thyroid. We also are blessed to have psychiatrists at our clinic a couple mornings a week, a psychiatry resident. So we provide mental health services, and we do also do some dental and optometry services. So we really strive, in addition to providing those medical services, to help patients with other issues by providing case management, health promotion, educational programs, and then we provide all the medications for our patients, which has a huge impact on their lives.
That's probably one of the most difficult things for people is, being able to afford medications.
Yes, for those that have chronic illnesses such as diabetes.
How are you funded? I wasn't going to ask you that, but when you share the scope of what you do and even adding the medications, funding, where does that come from?
Yes, funding. That keeps me up at night sometimes.
No kidding.
Well, all three hospitals provide in-kind and funding to us.
Thank you,
yes, Lord. Yes, and we can talk about how we help the hospitals later on if we have time. But we are a United Way agency. We also get, for example, some different grants. We get some support from City of Killeen, City of Harker Heights. We have a grant right now from Texas Methodist Foundation. We receive charitable bingo through the Boys and Girls Club. And then we also have a fundraiser, and we do love to just get checks in the mail
Yes,
from donors.
from individuals.
Yes,
Yeah.
yes, and we really want to build that donor base.
Absolutely.
The other thing we would like to see is more support from churches.
Mm-hmm.
We're really a home missions project.
True.
And so I think many times congregations try to help their congregants that have medical problems.
Certainly.
But they cannot afford and have the resources
Right.
that we're able to provide.
That's right. And how many people per day, and what you're open 5 days a week?
We're open 4 days a week, and that
Okay.
includes 2 night walk-in clinics.
Good.
And then last year we had 8,075 patient visits in all of our programs.
That's amazing.
Yeah.
And you partner with other agencies in the area, don't you?
Yes, we have several charitable clinics in the area. For example, the Cove Homeless Shelter has a Tuesday night clinic over by the Medical Arts Pharmacy in
Kind of a
Copper's
mobile
Cove.
clinic, correct?
Yes, it's just there one night a week. No phone number. People line up outside. Body of Christ Clinic is in Belton. It serves Belton and Salado Independent School District zip codes. We have Temple Community Clinic over off of Highway 53 in Temple that serves Bell County residents who are adults. And then there's also a federal health center called the Clinic at Santa Fe, and it
Santa Fe
provides
Hospital?
services.
Is that a
Yes, in
Veterans
Temple.
Hospital?
No, it is owned by Scott and White now,
by Scott
but yes, that's a federal health center out of Waco.
Okay.
And then there's also Bell County Health District, which provides low-cost shots and family planning, other services for folks who don't have insurance or who are underinsured.
That's so important, and I know that all the information is going to be on the screen because there are resources available.
Yes.
There is help available.
Right.
And this program in part is for you to be able to make that contact, and also for, you know, just education purposes, as we've said in the other segments. Neeta, I want to bring you in. You work as a caseworker with Bell County Indigent Health Services, and share a little bit about your office and your specific job and how you assist people.
Bell County Indigent is a health coverage provided by the county, by the government. We reach those that are 21% below the federal poverty line.
Okay.
We have eligibility standards that we have to go by. We also have navigation services as well.
And what does navigation services mean?
Navigation is where you're assigned a caseworker who assists you to meet healthcare goals that you're in need of. And we collaborate with resources in the Bell County community that might be able to assist you with those healthcare goals.
Yes.
It's kind of an intense case management program
Right.
where we follow up with you, we check on you, see if you were able to go to the places that we've sent you to or referred you to, and if you got the help that you were in need of.
Right. How do people access your services?
We have a website, the Bell County website, but we leave our applications outside our door at the Bell County Indigent office on 309 Priest Drive. They can access the applications there, or just come in the office on Tuesdays from 9 a.m. to 2 p.m. That's our
That's
open
here
day.
in Killeen.
Yes, ma'am. And then we're also at the Temple Community Clinic on Tuesdays from 9 a.m. to 2 p.m. and we do applications there as well.
You know, that is a wonderful service that is being provided, because it really takes an individual and it will help follow up. It will, from maybe an individual seeing a doctor is probably referred to you. And that is a person that already possibly has some transportation issues and just needs the little bit of extra help connecting them to all of these services. And I think it may be one of the services we have in the region that some people know the least about. I have not had your office in to do an Attention Central Texas with, and my daughter does your job in the state of New York, so that's why when you started talking, I perked up, and I love that this service is being provided to the elderly, to homeless, to children, just to poor people that are suffering even temporarily that have to have that extra hand. So I want our audience to know more, a little bit about what you do. How do you, there are some hurdles that people have to go through. There's eligibility that you talked about. How do you help people even in that aspect when maybe some of you have family members or you yourself need help? I want you to be able to share with our audience exactly the procedure, the process that they would go through to connect with you.
Well, after we receive the application, we need, forms of ID, forms of identification to get onto our program. But the navigation program is set up to kind of assist with some of those hurdles or barriers that they maybe have to get an ID, to get a birth certificate, because sometimes there are other forms of identification we can take besides just ID, Social Security, or birth certificate. Yes, and then there's we also have a resources limit on how many resources that you can have to be on our program. You also there's unearned income standards. You can't have over a certain amount of income each month. There is earned income. If you are working, you can't make over a certain amount per month to be on our program. But we also we try to assist with transportation the best we can. In making it to our office and turning in the documents, because that can be a big issue.
Certainly.
Is just turning in the documents.
Yeah, those are all hurdles that people have to, deal with. And Marlene, I want to ask you about your experience, your personal experience, and possibly situations, cases that you've seen that are successful and turned around. And you may be wanting to chime in on this too, because we really do co-labor together well in this region.
Yes. Well, I really would like to talk about diabetes. Diabetes impacts so many in this country, and it impacts so many other health conditions in the body. Through our program, patients receive not only medications, but they also receive guidance from a nurse how to take those medications. We also give our patients a free meter and very low cost strips and free lancets and needles. So also we have an education class on diabetes. So we strive, the staff, to provide everything a person needs to be successful. We've had wonderful stories of two people I know of in the last year whose A1C level went from 14 to 6 in about 6 months.
People are being helped. People are, people's lives are being changed by the services that are being provided.
We like to say our clinic is a place of hope and healing, and we see that in the patient testimonials. We have some videos. We celebrate the successes of our chronic care patients every year in a special luncheon where we honor those who have really achieved a lot. And we have, for example, a True Grit Award for someone who has worked through hardships to improve their health in the last year. Yes,
that's amazing.
So,
Amen. Have you? I don't know how long you've been at your job, but I know that it's rewarding to see people actually get better and get the care that they need. Do you have any particular things that you'd like to share along those lines that you've seen that can make a difference in people's lives?
Well, I have a couple of clients who, one I worked with at the mental health courts. But that was a big collaboration of several agencies in the area helping this one individual. And, when she came to the court, her life wasn't quite going too well. And after everyone collaborated and got her all the resources that she was in need of, she has now been clean ever since. Wow. And she has her own apartment now that Central County Services has provided her with. And she's getting regular mental health services as well. And we provided her a doctor, and she's getting the medications that she's in need of because she had other physical health issues as well. And, being a navigator, I check up on her, see how she's doing, and seeing if she's still staying and doing the things that she needs to be doing.
Amen. That is powerful, you know, and that's a generational impact, actually, because as we discussed in previous segments, a lot of this is learned behavior. And when someone is trained and gets the help and even knows that people care, it will make a huge difference. Marlene,
Yes.
we've got 2 or 3 minutes left.
Yes.
What is it that, you know, you'd really like the community to know about the health care that's available?
Well, I guess I would say that if you know of someone who doesn't have health insurance, who might fit in this discussion, really reach out and try to help them get the resources they need. Because many of these folks use the emergency room as their provider, as their doctor, and they can't pay for those visits. Some of them are so sick they end up in the hospital. The hospitals have millions of dollars of uncompensated expenses, and all of us pay for those expenses eventually through our insurance costs.
That affects what we pay.
That's right. The other thing I want to say is that we really didn't touch on food insecurity, but
Go ahead.
that runs through this whole discussion. And I'm on the Feast of Sharing Committee. HEB is doing their community dinner here December 11th. And HEB celebrates the holidays with this free dinner with all the trimmings, including entertainment. HEB pharmacists will be there doing free flu shots, and we'll also be there, the clinic, doing free flu shots for children 6 months and above. So it's really a community celebration of friends and community meeting together. It will be at the Killeen Conference Center the 11th from 4 to 8 p.m. And so I hope folks will come out, military, civilians. The music there is great. Santa will be there for the kids.
And I'm sure Temple has
one.
HEB is also doing
There's
events.
one in Temple.
So there are events like this, and food is a major issue for people. There's no doubt it affects their health as well. You did mention in our last minute that there are mobile units that are doing health care.
There is one. There's a pediatric mobile clinic that is at different sites throughout once a month in Bell County.
That's wonderful.
So,
in healthcare, and we've got 30 seconds left. Healthcare for women. You mentioned you don't do that type of care.
Bell County Public Health Department has an office in Temple and Killeen, and that agency does healthcare for women, low and free cost immunizations, STD testing, lots of health-related services.
Wow. Well, this has been an informative hour, and I know that those of you that are watching have picked up some information that might be helpful in your neighborhood, in your family. The numbers are on the screen, and you can call KPLE-TV as well. Thank you both so much for being here and for all that you do.
Great.
And thank you for watching today.